Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Clostridium perfringens belongs to the family Clostridia, which are obligate anaerobes. Organisms that do not require oxygen to grow and actually fare better in its absence. Clostridia and other anaerobes generally lack the enzymes catalase or superoxide dismutase, making oxygen toxic to them. In their natural environment, they thrive in deep, compact soil. When exposed to fresh, oxygenated air, they often respond by producing spores. These spores are highly resilient, capable of withstanding harsh conditions, including cooking. Once favorable conditions return, such as during slow cooling or improper storage of food, the spores can germinate and develop into active Clostridia. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. At an optimum temperature, Clostridium perfringens exhibits one of the fastest growth rates among bacteria. In the laboratory, when performing a Gram stain, Clostridium perfringens appears Gram-positive, meaning it stains purple, and it is characterized by its large cylindrical rod shape, also known as bacilli. Clostridium perfringens is a frequent cause of food poisoning and is often nicknamed the Cafeteria Germ. This is because it commonly infects food prepared in large quantities and kept warm for extended periods, as is typical in cafeterias or buffets. Clostridium perfringens is naturally present in the environment and can contaminate food that has been left out for too long. When a person consumes food contaminated with Clostridium perfringens, the bacteria quickly colonize the gut. Within 24 hours, the bacteria begin producing Clostridium perfringens enterotoxin, or CPE. The Clostridium perfringens enterotoxin specifically targets the tight junctions that hold the epithelial cells lining the intestines together. When these tight junctions are destroyed, it leads to inflammation and weakens the structural integrity of the intestinal wall. Fortunately, Clostridium perfringens enterotoxin is heat-labile, meaning it can be inactivated by prolonged cooking at 72 degrees Celsius or higher. This is one reason why freshly cooked food is the safest option to eat. However, uncooked foods like salads or reheated items like leftovers can provide an ideal environment for Clostridium perfringens. Symptoms of Clostridium perfringens enteritis include abdominal cramping, watery diarrhea, and vomiting. Thankfully, these symptoms usually improve within a day as the bacteria pass through the intestines. When it comes to treatment, antibiotics are unnecessary. The primary focus is on ensuring the individual remains well hydrated. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Clostridium perfringens can sometimes infect a wound instead of entering food. This typically occurs when wounds are caused by dirty, sharp objects that come into contact with soil rich in Clostridium perfringens and other anaerobes, such as gardening or farming equipment. In the case of a deep wound, it can lead to Clostridial myonecrosis. This condition is driven by another toxin, Clostridium perfringens alpha toxin, CPAT, which directly damages cells, causing them to swell and eventually lyse, or burst. The result is the rapid and extensive destruction of muscle and soft tissues, ultimately leading to tissue death or gangrene. Symptoms of myonecrosis include intense pain and swelling, with thin, watery pus sometimes leaking from the wound. In some cases, extensive tissue damage causes blood vessels to rupture, forming blood-filled bulli on the skin above the gangrenous tissue. A hallmark sign is crepitus. the crackling sound felt when pressing around the wound, caused by gas moving within the tissue, hence the term gas gangrene. This rapidly spreading infection and severe tissue destruction can result in fever and tachycardia, and may progress to hypotension, shock, and ultimately death, all within a matter of hours. Clostridial myonecrosis can be challenging to diagnose early, as it often resembles cellulitis. Since untreated gas gangrene spreads quickly, the diagnosis is typically made based on the infection's severity and rapid progression. While an anaerobic tissue culture can confirm the diagnosis, it usually takes several days, far too long for individuals suffering from gas gangrene. Treatment of Clostridial myonecrosis requires immediate and thorough surgical removal of the necrotic tissue, which may sometimes involve amputation of an affected limb. Supportive care is essential to manage fluids and maintain hemodynamic stability. High-dose antibiotic therapy with penicillin V or clindamycin is necessary to eradicate the bacteria. In severely ill individuals, additional broad-spectrum antibiotics may be administered to address potential co-infections. Hyperbaric oxygen therapy is also occasionally employed, placing the individual in a chamber filled with 100% oxygen, as this high oxygen level is lethal to Clostridium perfringens and other anaerobes. Summary of Clostridium perfringens. To recap briefly, Clostridium perfringens is a gram-positive, spore-forming, obligate anaerobe found in the soil. When it contaminates food, it can lead to food poisoning due to toxin production. Clostridium perfringens food poisoning usually causes mild symptoms, lasts around a day, and resolves without the need for antibiotics. If Clostridium perfringens infects an open wound, it can result in Clostridial myonecrosis, or gas gangrene, which can be fatal within hours if not treated with surgical removal of necrotic tissue, penicillin V, and sometimes hyperbaric therapy. Thank you so much for watching. Don't forget to subscribe to my channel, press the bell icon button. Thank you!